integrated development programs in the health sector. Our goals for this session are threefold. First, to summarize and really explain what exactly is behind this concept of gender synchronization. The second is to share some programmatic examples that illustrate how gender synchronization is operationalized. And third is to have a healthy discussion about the challenges and benefits of implementing gender synchronized programs. So just a few words of background to set the stage. About 4 years ago, members of the Interagency Gender Working Group recognized that development organizations doing gender transformative work within reproductive health were essentially lined up in two camps. Those that have a very strong philosophy and expertise around women's rights and empowerment, and those organizations that are strongly committed to engaging men and boys and really lead with that expertise. At that time, we really couldn't think of too many organizations whose core mission and expertise clearly incorporated both women's empowerment and men's involvement. Instead, work in these areas was implemented in sort of separate, parallel streams. We all agreed that gender transformative programs with women or with men are great, but also recognize that they're limited in their ability to bring about lasting social change. And this is because they work, if they work with only one sex or the other, they neglect the reality of gender, which is that it is a relational concept, and that gender norms and expectations and those dynamics are constantly intertwined between men and women, and actually are constantly reinforced by everyone in the community. So we commissioned two excellent thought leaders and practitioners, Meg Green and Andrew Levac, to help think through and really articulate this concept. And that's how gender synchronization was born. We're very fortunate to have both Meg and Andrew here with us today on the panel, along with two other experts, to share their thoughts and experiences with gender synchronized programs. Just a few words on how we organized the panel. We'll have Meg Green present first, and then and she'll provide kind of a full explanation of the concept of gender synchronization. I do have some hard copies of the white paper that was developed that explains it, and the lucky few will be able to pick this up. If we run out, I did also bring web cards of the Interagency Gender Working Group link to their website, and you can download the document from there. After Meg, we'll have three presentations that demonstrate examples of gender synchronized programs in the field. If possible, I'd like to hold off on questions until all presenters have had a chance to present. And so just to begin, I'd like to introduce very briefly our speakers. Dr. Margaret Green has worked for over 20 years on the social and cultural determinants of health, development policy, and gender. She's widely known for her research and advocacy on the conditions faced by adolescents and by women in poor countries, and on engaging men and boys for gender equality. She leads Gender Works, a consulting group working to promote social change for health and development, and is chair of the board of Framundo US and secretary of the Coalition for Adolescent Girls. Andrew Levac is the deputy director of U.S. programs for Framundo. Previously, Andrew worked for over 15 years with Engender Health, where he served as the director of Engender Health's Global Menace Partners program, and more recently as the director of Engender Health's projects within the United States. Andrew has worked for in more than 20 countries in Africa, Asia, and Latin America, and he's a founding member of Men Engage and is the co-chair of this symposium's program committee. Andrew is based in Austin, Texas. Brad Kerner has worked on adolescent reproductive health for 15 years. He is the team leader at Save the Children US's Adolescent Health. Brad is very passionate about developing innovative behavior change approaches that involve men and boys in sexual reproductive health and gender equality. He has spearheaded an approach to change gender norms for very young adolescents, which he will present today. And then our fourth speaker is Morgan Garcia. Morgan has been advocating for improved health care for vulnerable populations, especially women and girls, since 2005. She has experience working on issues of stigma and communicable diseases, on violence prevention and response in the United States, Peru, and South Sudan. Most recently, she was working on sexual reproductive health and rights for girls and women in Uganda. And Morgan is now the Sexual Reproductive and Maternal Health Manager for CARE International, in Papua New Guinea. So, Meg, thank you.
Because I think that this concept kind of encapsulates where our field has gotten to and the incredible power of coming together to work for something that is so beautiful. And so now for the dry conceptual stuff, but I'm really happy to be here and really delighted to be together with my fellow panelists. So the basic message is that gender transformative programs for men and boys or for women and girls are great, but that they're so much more powerful in bringing about social change when they're kind of conceptualized and brought together. And the reason they're limited in their ability to bring about lasting change sort of on their own, because they work with only one sex or the other, and they neglect the reality that gender is relational, and so it has to deal with everybody and their relations with each other in society. And we on the panel believe that this is sort of a really big mandate for our field going forward. So, as Michal noted, there in the field of gender transformative work, there are these two strands of work in parallel. In many respects, they're slightly different from each other, but the work with women often focuses more prominently on deconstructing the sources of power that perpetuate the oppression of women by addressing these power dynamics and by empowering women with skills and access to resources and so on that make a difference in their lives. And one of the things that we suggest is that sometimes, because of the focus on developing the individual, that these activities can be more empowering than transformative. And this is because while they increase women's ability to achieve specific changes in their own lives and in behavior or access, they don't necessarily challenge the social order that gives rise to women's disadvantage. So you have that work with women, and then the work with men, which is more oriented toward raising awareness of the constraints of the social context and the ways in which a fixed masculinity has costs for men as well as for women. So what's missing from these approaches is an understanding of how of the deep connections between the norms for men and the norms for women, and how they fit together and reinforce one another. And because of that, gender norms are reinforced by everyone in the community. And again, because gender norms are so deep, there are many, many different practices and beliefs that reinforce them. And what's also missing is the recognition that to bring about deep social change, everybody needs to move. Everybody is interconnected, so everybody has to step at the same time to bring about that change. So some of the ingredients that we highlight in our paper in defining gender synchronized programs are that they're intentional about bringing together gender transformative work with men and with women. That they engage both sexes in questioning the harmful constructions of masculinity and femininity and in understanding the costs of those things. That they equalize the balance of power between men and women with the idea of moving toward gender equality and addressing some of the constraints to health and education and all of the good things that we want everybody to have. They view all actors in society in relation to one another, so never thinking about an individual as completely separate and not contextualized within the social fabric. And they identify and promote shared values that support human rights, nonviolence, equality, and gender justice. So these are some of the commonalities across gender synchronized programs. There are, despite the title of the slide on examples of gender synchronized programs, really what I want to highlight is that we can think about these programs as a typology in a way, and there is an emerging set of programs in this area. First, programs that began by addressing the needs and vulnerabilities of women and girls, and then developed an awareness of the need to include men and boys. Others that started with men and boys to deconstruct harmful gender norms, and then recognized that it would make sense to include women and girls. And then a third and much smaller category of programs that have from the beginning had the vision to work with both men and women together. And I, of course, have some ideas about programs that might fit in each of these categories, but instead I will just transition to the presentations by my table mates up here, because this is exactly what they're talking about today. Thank you.
My title is a little confusing. I'm speaking in the program on behalf of Engender Health, but my official title these days is Deputy Director for U.S. Programs Promundo. About 2 months ago, I took on a new position with Promundo to expand their domestic portfolio within the United States. But I have a long career with Engender Health, and I'm going to be speaking today about Engender Health's work in the United States, in Austin, Texas, around this issue. I had a really unique opportunity, and it doesn't always work so symbiotically, but when Meg and I wrote this paper was the same time I was writing a grant to do work in the United States for the first time. And for those of you who aren't familiar with the sort of sexuality education landscape in the United States, there really are very few programs that even look at gender in any meaningful way at all. There's about 40 evidence-based sexuality education curricula in the United States that the Health and Human Services Department and the CDC sign off on. And if you look at those, only one of those will be classified as gender transformative, and it is one called CLA that only works with young African American girls. So there's really a sort of dearth of work around gender, or even gender consciousness in the United States. So this was an opportunity after writing this paper to have a grant funded that specifically was going to be gender transformative, but was specifically going to look at this idea of gender synchronization and being quite thoughtful about how to bring young men and women together. And it was funded under the premise of teen pregnancy prevention, which is a huge issue in the United States. U.S. has a higher rate of teen pregnancy than any other high-income country around the world, huge disparities compared to other industrialized countries. And in places like where I live in Texas, where there are extreme policies against sexuality education, you have even higher rates of teen pregnancy. Imagine that. Texas has the third highest rate of teen pregnancy in the country. So that is from which this work is occurring. Let's see, let me find where I can move that. So the project I'm going to talk about is called Gender Matters, or GenM as the kids call it. It's a 5-year project, so it's finishing this next summer. It'll probably be, the analysis of it will continue 1 year further. And as I mentioned, it's, our donors are really interested in teen pregnancy, and we're really interested in looking at outcomes related to teen dating violence prevention as well. A specific group of youth in Austin are reached. They're aged 14 to 16. They're enrolled in a summer youth employment program, specifically because we wouldn't be able to provide comprehensive sexuality education in the schools. So we're working with kids who are actually enrolled in a 5-week employment program. And if they participate in our program, they get a 6th week of employment, which instead of working, as they get to engage with each other on exploring these gender messages. Population is about 90% people of color, Latino and African American. 80% of them reside in part of the city that accounts for 80% of all teen births. So very high rates of teen pregnancy in these communities. Gender Matters, what it is it's educational workshops, a curriculum that goes over 20 hours, and a way to continually engage them is to use social media post-intervention. And during the workshop itself, if you'll see on the right, we use video. We actually take videos during the sessions themselves and have specific activities during the sessions that allow performance and personal testimonials. And we use all of that great footage to make documentary films and then re-show that over the course of time because we don't have any other way to follow up with the youth. So we engage parents with that. We have screenings of that. We use it on social media sites like Facebook and play that information. And it's a way to reinforce the messages for a population we wouldn't otherwise receive, because what we know about gender transformative interventions is that they need reinforcement. The workshops themselves are delivered over 5 days. And we intentionally have a male and female facilitator who deliver the intervention. And the intervention is founded upon these concepts of gender, and that's explored in day 1. And then over the next 5 days, we constantly revisit that issue of gender. And I want to kind of just dive into now to the meat of this, which is to talk about, well, why is gender synchronization important in the program, and what does that look like? Well, we're working with middle school kids. Some of them are as young as 14, and so abstract thinking sometimes is a challenge at that age, developmentally. And so particularly for our younger youth, a lot of times, asking them to identify, societal constructs of masculinity, although we wouldn't say that, we would say, gender messages in society, is still a challenge. And so we use, we're in the United States, the land of hypermasculinity, so you don't have to look far to get examples of what those societal messages are of. So here's a few examples of things that we've taken out of society to have young people reflect on. And I guess I would ask you, so are these the messages that are supposed to be focused on the guys or the girls? And I think the answer is quite obvious, right? These are messages that influence both men and women, right? So you've got the objectification of women in that Budweiser ad, and a message clearly given to men that they should expect everything. And so we want to look at how that message affects men and women both. Similarly, the Lil Wayne great album cover called Young Money Playboy is there, and you've got Lil Wayne with sipping champagne and throwing money over scantily clad women. Who should reflect on this message, right? And why should we talk about it? So, this to me shows the context and the environment about why we need to explore these things together, and have men hear from women about how it feels to see these images, and have women hear from men about how they interpret these messages to move that dialogue forward. I mean, some of this work has been happening forever. I think a lot of people know about the Gender Fishbowl, this kind of classic activity where you bring women in a circle and you have them reflect on their gendered experiences, and they talk about that. And as you can kind of see around that fishbowl, as young men simply listening and hearing women's experiences. And then the process is reversed, and young men come in and share their experiences, and women come hear it. And I was thinking yesterday about Michael Kimmel's thoughts about when he was talking in the plenary about, what do you see when you look in the mirror, and how that white woman of privilege had no idea that the African American woman saw a black female, not just a female. And I think that speaks to sort of the ability to provide opportunities to understand and empathize and understand oppressions that people experience. And particularly with this population of youth that we work with, not only do we want to hear young men hearing young women's experiences, but young women want to hear young men's experiences, particularly young men of color in the United States, as Q mentioned today, and those complexities that exist in the United States. So it shows the importance of that. This is a very hard slide to read, but it's important, so I'm going to have you bear with trying to look at me and my peer educators chicken scratch there, but this is a classic sex ed activity that's been done in a lot of teen pregnancy prevention things. It's about sexual decision making, and typically you would have a group think about reasons why you may decide to have sex or not to have sex. But in Gender Matters, there's always men and women together in the same room, but oftentimes we find opportunities to break them up into single-sex groups, male-female groups. And it's really interesting if you do that to really then deconstruct what are some of the gendered messages and their responses. So if you take a look at the differences between young men's and women's responses here, it's pretty interesting. So a lot of the men's responses about why they would decide to have sex are about fame and to have a rep and to work out, to pass time, something to brag on. A very sort of individualized, affirming piece about their reasons. And if you look at young women's, there's a lot of stuff here about coercion, to feel pressure from your friends or girlfriends, so the boy that won't leave you. And a lack of agency around sexuality in the mood, the H word, couldn't say horny, right? Couldn't sort of embody that. So this is an opportunity, right, to explore why do these look so different? Why is love in the group that the girls said, and why isn't that mentioned in the group that the young men said? But to have that opportunity to explore that and to then go back to the gender messages and deconstruct them some more, it's quite powerful, but a lost opportunity if you're just making a rote list of reasons. And finally, just one more example of the power of this. When we talk about exploring sexual consent and coercion in a mixed sex setting, it can be pretty powerful. In the United States, there's a lot of focus on these evidence-based interventions about the skills for abstinence, right, and the skills to say no. And they'll take you through all these steps. You have to say no, you have to repeat the response, you have to state why, you have to suggest an alternative and walk away. And right, people constantly build that skill. And there's actually evidence that works, right, that you've kind of practiced that, you role play it. But it's in a gendered world where young women are experiencing coercion, then that's a skill that's being essentially put on them, right? They're the ones who are sort of implicitly expected to be the arbiters of that. So what we do in this is we have an opportunity for men to practice accepting no. And we say that that's a skill, right? So that's what this young man's doing, and it's not much of a practice like, oh, okay, that's cool. All right, thanks, right? But find your words for it, right? And make that important and demonstrate that with men and women together and let them see that. And let that be normalized, that's the expectation. All right. Just a few reflections about what we can say about Gen M. I wish I could tell you the results of our randomized controlled trial, but they're not done yet. There's 3 cohorts, and the final 3rd cohort just finished this summer. For each of those 3 cohorts, there's a follow-up at 6 months and at 18 months, and it's a quantitative survey. Thank you. It's a quantitative survey that's looking at particular outcomes around onset of sexual activity, use of condoms, use of contraception, experiences around intimate partner violence. And then we're also doing qualitative data to track that experience. And so I will just share and finish up with just a few quotes from that to share with you what that sort of looks like. And I think this kind of gets to the first 2 I'm going to show you are about relationships, and the last 2 I'm going to show you are about the value of working together. So this is a male participant, 16 years old, and this is him reflecting on his experience at Gen M. He says, I really like my experience because I have a girlfriend, and this really did help out my situation with her. Our relationship has gotten better because I learned so much. And every time I came home, like every day I came home and I'd have something new. I learned something new, and it really helped our relationship-wise. I learned about sexual consent. That's very important, and if I would have known, I would have asked, but I didn't know anything about that. So when I told my girl, did I ever cross the line? And if I did, I won't ever do it again because now I know about sexual consent, and she was so happy. She was like, oh my God, I love this thing. And we talked about respecting each other and giving each other space. It really did help a lot. I'd like to think that him being in a group of women and talking about these issues made it much easier for him to have this engagement with his partner when he got home. And then if we look at a perspective from a young woman, we have these sort of key messages, these 6 key messages about Gen M, and one of them is, I decide if and when to have sex. And so this was a question about this. And this, to me, I think speaks to this idea of empowerment embodied through sexuality education. So this is an interviewer talking to a young woman. Let's look at this last Gen M message that you told me, I decide if and when to have sex. Why is that a particularly important message to you? Because in high schools, the people say that that's where you have to lose your virginity, and that you have to do it. And then your parents and older people tell you you can't do it till you're married. I've never really had someone tell me to do it when you're ready. Interesting. Can you tell me a little bit more about what it felt like to hear it, to do it when you're ready? It made me feel at ease, because then I don't have to worry about, oh, I have to get married, or oh, I have to do this by the end of high school, but to do it when I feel ready. And what does being ready look like for you? Confident, having someone good by you, understanding, trustworthy. So again, I think you've got a norm here of young people coming together and defining what that healthy relationship looks like. And I think that the young men are helping her to some extent define that. I'm going to finish with two quick quotes in the end that really talk about this dynamic about why we should have why we should sort of try to synchronize this work more. This is a young man who says, "My experience in Gen M, really I learned a lot. I learned that my opinions about women weren't all right, but the girls' opinions of men weren't right either." All right, so it speaks to a relational piece. All right, and finally, one question is, they kept on talking about how the Gen M guys treated women differently and thought differently about this stuff than the other guys in their community. But these guys were from their community, and I think it has to do with that little bit of there's actual norms and then perceived norms. So I think this will speak to that. The researcher says, is there anything about the kids at Gen M that remind you of your friends specifically? No. What's so different about them? Like how they think about girls and everything, that they're not all meat. But some of my friends, yeah, they just think that. Just think what? My friends think that they're pieces of meat. That they think that girls are pieces of meat? Is that stuff your friends talk about at home? Your friends? Yeah. So this idea that, guys think that Gen M guys are different. And so, there's a question of is that social desirability from being in the group, or is that an actual impact of the program? I guess my response would be, what does it matter? If it's a sense of social desirability and you're changing that norm in that mixed sex setting and that expectation that is the norm, then I think you're moving towards achieving that norm. So, thank you very much.
I think I'll put my props here. I only brought 3 props. Am I in the right? Yes. Great. Well, good morning, everyone, and thank you for having me on this panel. I guess I'll start off by saying that, as you can see from my job title, like most of our panelists here, I've come into this work from a sexual and reproductive health lens. And the privilege I have of being a male working in this field is I get to bring in the male and boys' voices into this work. And what I love about doing that is being able to see women and their partners having couple communication and talking about the power relationship and how it affects their decision making around sexual and reproductive health, and how great it was to finally have a name for that: gender synchronization. So you should definitely read this report because it helped me as a practitioner. It really did, and I remember being part of those discussions, and it is a great way to conceptualize this. So I'm going to be talking a little bit about how Save the Children we think about gender norm, what we call formation. So we've already heard this term gender norm transformation, and that's typically the term that you hear out in most of the reports. But we think that you can start much earlier. You don't need to transform a norm when you can form it right from the beginning with children. I do want to recognize some colleagues I have in the room who work a lot with very young adolescents. I have a colleague, Ben, in here in the front taking a picture of me from Uganda. An excellent practitioner with very young adolescents, as well as Shiva and Sony from Nepal in the back who also work on these programs. So as I alluded to already, when I talk about 10 to 14-year-olds or very young adolescents, I'm talking about that 10 to 14-year-old age range. And really, this is this window of opportunity to work on gender norms. I'm convinced of it, and I hope to convince others, and you start reading about our materials. This is the time, prepubescent, starting puberty, identities are starting to be solidified, they're testing out who they want to be in the world, and it's typically, in most contexts, before they're sexually active, before they drop out of school, it's this opportune time to start working around gender with them. I know a lot of people say, oh, you can start way earlier, you start with teachers and how they treat them. But I really think when you're trying to affect that individual level, this is the time we really should be starting. And not to say that you can't do it with Gen M and starting with the 15-year-olds, but it might be a bit more challenging to transform a norm than when you have that opportunity to form a pro-social one. So, I mean, look at them. Look at how cute 10 to 14-year-olds are too. They're so fun to work with, and they're ready for this. So I'm going to talk about a package of 3 interventions that we work on that helps form pro-social gender norms with very young adolescents. They have some interesting names that some people like and some people say is a mouthful: choices, voices, and promises. And I should start a competition right now because I need a better name to how I talk about the full package. Right now I'm calling it our gender norms package for very young adolescents. So if you have a catchy title, please come see me afterwards. So this is, we have 3 interventions because we really are thinking about the ecological model that so many of us know, working at the individual level, then at the family level, and the community level. Often when you're working with older adolescents or adults, that family level is more of a relationship level. So you and your partner. Here, that relationship are families, them and their parents. And the point I want to make around gender synchronization is an ecological model really syncs well with this approach because as Meg said, it's everyone's business to be doing this work. And so if we were to just work at the choices level with the boys and girls, we're missing all those other people that affect their decisions, their attitudes, and their ability to make the choices that we want them to make or that they want to make. So an ecological model really does reinforce this gender synchronization approach. It wasn't so, it looks great to have this slide, but it was a little bit more organic in its process. We started with choices, and we also went into choices thinking we were going to work only with boys. So truly engaging men and boys in this work. And through our formative research, we realized we cannot be working with boys without girls in the room. They need to be talking to each other. And it was really talking to the girls and them telling us, we need the boys to hear about menstruation and Eve teasing and all the things happening to us. Why aren't you working with them? And we said, well, why aren't we working together? And that's kind of how we got into this work, and then slowly started adding the pieces. We actually added promises second, hitting the community level, and then realized we needed to take a step back and get a little bit, have an intervention touching with those parents. So I'll go into each of these interventions in a little bit of depth, just so you can understand what we're doing at each level. So choices started in Nepal. It's now in about 8 countries. And it's really 8 activities that are facilitated with groups of boys and girls, typically in a out-of-school child club, let's say in Nepal, but in some places like Bolivia, they're doing it inside the classroom. Other settings, it's extracurricular, but still on the school grounds. So it could be designed and developed for whatever existing platform that a program has. It's relational in a way that and it's this gender synchronization approach in my mind is because the younger adolescents really aren't being lectured to. They're not being lectured about power and gender. And if you read it, it is here, one of my props. If you read it, you will never find the word gender or power in there because those are concepts that aren't easily understood by a 10 to 14-year-old. We talk about hopes and dreams, how you can be a hope provider to somebody else, how we can be a hope provider to your sister and reinforce those dreams together. And I think just by having a sister or a girl be able to express their hopes and dreams in the presence of some of these boys, especially in a place like Nepal, it's already transformative. It's forming this idea that this person is a person. They have hopes and dreams just like me, and I have a role to play in that. So that's where the gender synchronization comes in. Some of the outcomes that we're looking at with choices are around attitudes and behaviors. They're short-term behaviors, things that they could do, like promoting gender equity in their lives through small behaviors like helping out with household chores, equal time of studying, and maybe leaving for school at the same time. So at the next level, we have voices. This is the intervention that hits the parents, and it hits the parents of the children who are going through choices. So